cause and treatment of sprained knee. Before watching the video, like the video, press a subscribe button and turn on the bell so that as soon as a new video is released, you will be the first to visit the video. Symptoms of sprained knee. The complication of sprained knee affects all components of the knee. Of course, the type of symptoms varies depending on which knee ligament is damaged. For example, if the lateral ligaments of the knee are stretched and sprained, in this case, the patient suffers from severe pain next to the knee, and vice versa, that is, when the cruciate ligaments of the knee are stretched, in this case, the person suffers severe pain. The front and back of the knee are affected. Symptoms of a sprained knee generally include feeling severe pain in the side of the knee, feeling of pain in the front and back of the knee, swollen and warm knees, knee stiffness and dryness, burning sensation in the knee area. Complications of sprains, in addition to ligaments, put a lot of pressure on the muscles of the knee, so some people may have other symptoms such as knee muscle spasm, decreased knee range of motion, sensitivity to touch in the affected area, hearing a knocking sound in the knee, bruising or bruising of the knee. This indicates bleeding in the knee. Cause of sprained knee. Most sprains occur in the ankle, but other tissues, including the knee, also suffer from sprains and sprains. Sprains generally occur during physical activity. The activities that the person is doing should constantly change the position of their knee. Rapid rotation of the knee. Landing suddenly and quickly on the ground. Pause at once while running. Change direction at once while running. Straining or stretching the knee too much. Direct blow to the front or back of the knee. Injury to the knee when falling or slipping. Doing some wrong moves repeatedly and for a long time. So with these reasons mentioned for sprained knee, sports activities are one of the main activities that cause sprains in the knee, and the main reason is due to the pressure that is applied to the knee during these activities. Of course, sports activities did not necessarily cause sprains or sprains, and a person at home may suffer from this complication due to an inappropriate movement. Most athletes always keep their leg muscles strong and flexible because they are aware of it. Hence, this complication is common in athletes who have weak knee muscles and joints. It happens. Treatment of sprained knee. If you have mild to moderate sprains, you can treat this complication with the help of home and conservative solutions. These methods are very effective in reducing pain and recovering the affected area. You can do such things to help recovery. Rest. When you get sprained, it is best to stop and do the activity that caused the pain as soon as possible. Usually, in cases where the sprain of the knee is mild, 2 to 3 days of rest is enough to improve it. It is better to avoid activities such as walking and activities that put a lot of pressure on your knee for complete recovery. Use ice. Using an ice pack on a sprained knee may help reduce swelling, pain, and redness because the blood vessels narrow. An ice pack can be applied to the affected area for 15 to 20 minutes, about 3 to 4 times a day. This treatment can be used for 3 to 4 days until the pain goes away. Keep your feet up. Holding the foot high causes blood to flow and reduces swelling from sprained knee. Note that when resting and lying down, the legs should not be below body level. Lower body position causes excess fluid to accumulate in the knee, which exacerbates pain and symptoms. Squeeze the knee joint. You can prevent the injured limb from moving by squeezing the knee. To do this, you can use a bandage or any other device that can be used to close the knee joint. You can use bandages first. Once the injured limb has healed, you can use regular bandages. Also, the band should not be too tight or loose. In other words, it should close in a comfortable position. The complication of sprained knee is usually relieved with the help of conservative treatments, but if the severity of the injury and sprained knee is high, you should see an orthopedic specialist or surgeon as soon as possible to diagnose the cause of your pain and get treatment faster. Prevent sprains of the knee. The occurrence of sprains not only causes pain and discomfort in the knee but also affects other areas of the knee and its surroundings, so the prevention of this complication is very important, especially in athletes. To prevent a sprained knee, You need to change your lifestyle in the first place. Things to do to prevent knee injuries and sprains include keeping your body weight balanced and having the right weight. Take precautions to prevent slipping or falling. Have a regular exercise program to keep your muscles strong. Having a proper diet plan to strengthen muscles. If you like this style of video, then subscribe and support me with your likes and comments.